Signs of mesothelioma usually appear decades after asbestos exposure. In most cases, symptoms do not show up until 20 to 50 years after someone first inhaled or swallowed asbestos fibers. This long delay is one of the main reasons mesothelioma is often diagnosed in later stages, when symptoms become harder to ignore. The most common type of mesothelioma is pleural mesothelioma, which affects the lining around the lungs. The earliest signs often feel mild and easy to dismiss. Many people first notice shortness of breath during normal activities like walking upstairs or carrying grocery. This happens because fluid can start building up between the lung and the chest wall, a condition called pleural effusion. Chest pain is another common early sign. This pain can feel dull, sharp, or like pressure inside the chest. Some people describe it as a constant ache that does not go away. Persistent dry coughing is also common. Unlike a normal cough from a cold, this cough usually does not improve with time or medication. Fatigue is another major sign. Many mesothelioma patients describe feeling extremely tired even after resting. This is partly because the body is fighting cancer, and partly because reduced lung function lowers oxygen levels in the blood. As pleural mesothelioma progresses, symptoms often become more noticeable. Shortness of breath can become severe. Some patients need fluid drain repeatedly to breathe comfortably. Weight loss can happen without trying. Night sweats and low-grade fevers can also occur. Another sign can be hoarseness or trouble swallowing. This happens if tumors press against nearby nerves or structures in the chest. Some patients also experience shoulder or back pain because tumors can spread along tissue surfaces. Peritoneal mesothelioma affects the lining of the abdomen and has a different set of common signs. The most noticeable early symptom is abdominal swelling. This swelling is usually caused by fluid buildup called ascites. The stomach area may feel tight or heavy. Abdominal pain is also common. This pain can be constant or can come and go. Some patients feel nausea or lose their appetite. Changes in bowel habits can happen, including constipation or diarrhea. One of the biggest challenges with mesothelioma is that early symptoms often look like common diseases. Pleural mesothelioma symptoms can look like pneumonia, bronchitis, asthma, or even just related breathing changes. Peritoneal mesothelioma symptoms can look like IBS, food intolerance, or stomach infections. Because of this, many patients are treated for other common conditions for months before doctors consider mesothelioma. This is why exposure history is extremely important. Anyone who worked around asbestos, lived near asbestos-heavy industries, or had family members who worked with asbestos should tell their doctor immediately. Diagnosis usually requires multiple steps. Doctors often start with chest x-ray or CT scans. If the fluid is present, they may drain it and test it. However, fluid tests alone cannot usually confirm mesothelioma. The only way to confirm diagnosis is through a tissue biopsy. Biopsy samples are examined under a microscope and tested for specific cancer markers. Once diagnosed, doctors determine the stage of cancer and discuss treatment options. It is important to understand that mesothelioma symptoms do not always appear suddenly. Many patients say they ignored symptoms at first because they seem minor. If someone has a history of asbestos exposure and experiences ongoing breathing problems, chest pain, abdominal swelling, or unexplained fatigue, medical evaluation is critical. Early detection does not cure mesothelioma, but it can help expand treatment options like surgery, chemotherapy, immunotherapy, and clinical trials. Mesothelioma is rare. Recognizing symptoms early can help doctors move faster toward diagnosis and treatment planning.